And here we are.
Oh yes, we are officially live. So hello everyone on our Facebook following page. This is Angela and I am the head of marketing at Pandia Health. And today we have an amazing live series or a live video with expert doctors discuss COVID-19. So this is a Pandia Health and the Village Doctor collaboration. I'll do some really quick introductions. So as you know, we have Dr. Sophia Yen down here. We have Danny Kelly. I love Dr. here. And we have Dr. Weiss.
That's easy.
This is actually our first time ever having 4 people on a live. So this is the first time. And
I'm just trying to find a way to put it on our Facebook page for the Village Doctor right now. So that's why I'm like totally scrambling.
We trust that we understand you got to do what you got to do. So I just want to say, so we have Dr. Weiss. He is the director and co-founder of the Village Doctor, and his partner, Danny Kelly, who deals with all things social media at TVD, and also our familiar face of Dr. Sophia Yen, CEO and co-founder of Pandia Health. And we have polled some popular COVID-19 questions from different communities on Facebook. Before we get into those questions, I want to give a background on Dr. Weiss and Dr. Yen because they are our expert doctors here. Quickly, as you all probably have heard about Dr. Yen's background, but she is our fearless leader at Pandia Health. She went to MIT, UCSF Medical School, UC Berkeley School of Public Health, and now she serves as a clinical associate professor at Stanford Medicine. She loves to say she eats, breathes, prescribes birth control. And then we also have Dr. Weiss here. He went to Stanford as an undergrad, UCSF Medical School, and then also completed, UCSF colleagues down there. And he also completed his emergency residency at UCLA. And he founded the Village Doctor to put the wow back into healthcare experience by treasuring the moments with patient relationship and wellness and putting it first. So I do want to prompt everyone to check out the Village Doctor by going to www.villagedoctor.com, as well as subscribe and check out their social media at Village Doctor. If you end up signing up for our services, use Village Doctor as a referral code. And we will be doing some follow-up blog posts on this talk. So this is not the last time you will see them. You'll probably see a blog post featuring the Village Doctor. So awesome!
Yeah, follow us. That would be great.
Follow them. So with that being said, let's go ahead and get started with some of these questions that we hold. So we're going to be going back and forth between me asking some questions. Danny's going to have a couple questions to ask as well. So we have a question from Mina. Mina is curious about immunity. So if she's tested positive before, can she get it again? And when you're carrying it, can you give it to other people who haven't had it without getting sick again yourself?
So I might pipe in with just a clarifying comment, and then I'm happy to hand off, get this mirror going here, right? But testing positive can mean different things. So I just want to be clear that when we talk about coronavirus testing, there's really 2 broad categories of testing. There's the famous nasal swab that is looking for actual virus in your nose. And we can talk about the implications of that. And then completely separately, there's a blood test that's testing for antibodies, that's testing for immunity, and antibodies develop after you have had an infection with something. So when people talk about I'm testing positive, it's important to understand which kind of test they're talking about.
And I think the question is asking, if I tested positive, can I get it again? And from my understanding, and please correct me, Dr. Weiss, if you've heard differently, that it has happened, but it's rare. It's very, very rare. I think there's only like 2 cases of where somebody had it and then they got it again. And maybe they just have a weird, horrible immune system that doesn't respond properly. And that's why it was such a rare, weird case. But we believe, and hopefully, you know, that's the point of doing a vaccine as well, is that if you get it and you fight it and you make the right immune response, you won't get it again. But it is absolutely possible to test positive and not have any symptoms and give it to somebody. And that's why it's so important that, you know, we wear masks, we wash our hands, and we don't try to infect other people, you know, and just because you don't feel like you have it, you could get it and then give it to, you know, God forbid, your elderly parent, or a lot of us are elderly parents, like 50 and above is where the danger happens. And so my husband just turned 50 and now he's like flipping out a little about COVID. Yeah, 50, you know, so like 50 and above is where that risk goes up. And so now my teenage daughter, firstborn, very responsible, is like, I don't want to go to high school and catch COVID and give it to dad, you know, because the youngins will do okay under 10, but they've shown, I'm an adolescent medicine specialist, that the teenagers, once they hit puberty, are like adults. And so their ability to catch badness is the same as the adults. Whereas before they put all kids into one bucket, but as adolescent medicine, you all know teenagers are different from the little ones. And so they catch it differently.
Care and care, don't they?
Yeah. And I think I would elaborate on that, that as you, not all adults are the same either. So clearly as we get older, 50 is still a baby, but as patients get older, their risk of being sicker is higher. So we do worry about these high-risk groups. So all of our respective parents are in a higher risk group, or people who have other underlying medical problems. So to go back to just your number, you know, this question, can you get it again? You know, you never say never in medicine. It's one of those dictates. But I think, and as we'll talk about over this hour, there's a lot that we've learned from other viral infections, and we hope and make some assumptions that what we know about viral infections in general can apply to this. It's a novel virus in the sense that this is a coronavirus that we haven't seen before, but there are hundreds of other coronaviruses, and so we have some experience. You know, there are, I think, 2 million cases of coronavirus. I have to stop and think about this in this country, much less globally. And the number of patients that where we know that they've had it twice is you could count them on one hand. It's like 2 or 3. So the likelihood of you getting it, recovering, and then catching it again, I would say is like virtually 0. So not to worry.
I actually want to.
Oh, sorry, you go for it.
No, go ahead, Danny. I already asked a question. Go ahead.
No, I was going to say, well, Mina continued on with the question, saying that her husband, and she had it, and it was horrible, but now she feels a sense of relief that it's behind her, but she's scared about the chances of recontacting it again and giving it to our children. They've also been having the odd pains and aches ever since and don't feel 100% the same as before getting sick. So I guess it's kind of on that same vein, but how do you hold a sense of peace after getting it and with your children?
Very good question. I'm going to start with kind of a testing question, and then we'll hand off to the adolescent medicine expert. So testing, I know someone close to my heart, and we got tested for antibodies a while ago. We actually hoped that we were positive, because for this same reason, is that if you test positive for antibodies, likely you've had it, you may or may not have been symptomatic, and likely you're protected. As we've learned more in this country, there's a fairly recent study, just in the last week or two, that only about 10% of Americans have actually been exposed to COVID, which means that 90% of us are still vulnerable, and hence the importance of this vaccine that Dr. Yen talks about. So we'll sort of start with that. And then maybe in terms of how to scaffold yourself and prevent or try to ward off these lingering feelings of just, I don't feel quite 100%. Why is that, and what could I do about that? Sophia, any thoughts on that?
Yeah, I think what I'm hearing in the question is they're afraid that they're going to give it to their kids, that they were positive and they don't know about their kids. But I'd say, as you said, if you were antibody positive and probably nose positive and then you heal, now you've got antibodies, that you most likely are not a typhoid Mary passing it around in your community. And in fact, a lot of us were hoping we had the antibody, so then we wouldn't have to mask up. We could save a lot of masks and we could go and help people, you know, and not worry about it. So actually, if you've had the disease, had a positive nasal swab, had a horrible disease and recovered, or had blood drawn and had an antibody, then the likelihood of you passing it on, you know, after recovery, so a couple weeks just to be safe, of you passing it on is very low. And actually those people I feel are magical because they have antibodies in their blood and people want to suck their blood and take out the antibodies and give it to other people. So they are absolutely doing that. If you have the ability, donate your blood. If you think you have antibodies, give it to science, give it to save people in the ICU, but don't worry about giving it to your children. I think a follow-up question to that would be, you know, if somebody's positive in your house, just new, and everybody else is negative, how do you deal with that situation? And I know that for the longest time, a lot of physicians not being positive, but just not wanting to expose their family have split. So we had one husband, wife, and children. The husband was in the basement because he was going to the hospital every day. And the wife and kids were up here in the house, and they did not connect and they did not touch because they didn't want to give it to each other. And that to me is just, you know, so heartbreaking. If this country could just shut down for 3 weeks, we could make it go away. But
So you could get all of it going, I think, around if this country would just, and we'll get to all of that later. Go ahead.
I was actually going to ask, like, you guys mentioned, like, you know, recovering. And they did mention, you know, they have lingering side effects or they just feel weird or like, you know, after you get infected, you're like, maybe it could be a psychological thing too, right? Where you're like, I'm just not the same. And so how do you know that you're fully recovered or that you're okay? Do you have to go in? I guess like usually for what I've heard is that after 2 weeks of quarantining and not showing symptoms, you're okay. But are you really? Or like, how do you know?
Well, so there are a couple of questions within that question, right? Are you okay? I guess it depends on what you mean by okay. So the 2 weeks of quarantine would mean that you're not contagious. So that means that you have recovered enough, your immune system has come up enough to prevent the virus from being spread, okay? And interestingly, and we know this with just, again, common colds, you're most contagious kind of the day before you even get sick. So in fact, the symptoms that you develop, the stuffy nose, the cough, the sore throat, all of that is your body's immune system responding to a viral infection. So the day before there's virus everywhere. By the time you're symptomatic, it's being attacked. And 3 or 4 or 5 days later, your contagiousness drifts way off. And so the 2 weeks is, again, playing it safe. And we could get into the numbers, but roughly, again, 50% of people at day 5 are still contagious. And out by day 10 or 11, it's in the 90%. And 2 weeks gives you that buffer. So by 2 weeks, again, assuming you're not symptomatic, you've been getting better, you're not contagious anymore. But are you okay is your question. And that's a different question. So there's a subset of people who have persistent symptoms. Again, normal viruses do this, coronaviruses do this, and it can take any, you know, variable amount of time. And with COVID in particular, it can take months to get better, and some patients don't get better. And we'll come back to this question in just a second. But the other piece that I wanted to just sort of mention and then pass this off is the emotional side of this, is that COVID is a highly anxiety-producing topic. And so for people who have COVID and are better, it's easy for them to be anxious about not being all the way better, about spreading something to their children. So in other words, I'm just trying to underscore that the mental health piece of getting better is really important. So much so also that the mental health piece of not getting sick is important. This idea of having your loved one live in the basement for 3 months and not talking to them, where medically it might be the safest thing to do, in the bigger picture, I think it's not the best thing to do. It's not healthy. So, and we can talk more about, for all of our friends and families who are sheltering in place, who are trying to be good, paying attention to their mental health, I think is also really, really important.
And I think it's important to also mention here that this is all generalizations. So this is none of this pertains to any particular person. So everyone has different levels in which in the way they live, and it's best to talk to your doctor about understanding exactly. So we're just looking at the medical facts as what is given to us.
Mm-hmm.
Yes.
So another really good point about risk and everybody's interpretation and judgment of risk to themselves and their family is different, rightly so.
Mm-hmm. Yeah, and I think that's actually, I believe you guys have a really great, I want to insert some great resources. So you guys have a great blog that kind of talks about like what's going on with COVID, different advice on, I believe you might have one that talks about like mental health or like, how to, help yourself there and what does that.
We have a hope and grace section so we have a weekly newsletter which answers around 5 COVID questions every week. That's delivered by the 5 doctors at the Village Doctor, 2 pediatricians and 3 internal medicine specialists. And so there's a beautiful bit down the bottom of the newsletter called Hope and Grace, which is just a little pep me up, because we're talking about something that's so dire and something that we're all just feeling the weight on our shoulders. And so let's also lift each other up, because I'm pretty sure a lot of us are hearing it 24/7 wherever we're at. And why not look at all these, like we just shared a video of the Stanford band students all getting together, similar to this, Brady Bunch style, and doing a song. And those things are just so beautiful, like the change that our humanity has come to the surface here, and how much we want to be in community. And even though we're also isolated, we're doing our best to create this beauty of music. Or did you guys see the Hamilton? How Hamilton? Yeah. Oh my God, the Hamilton cast got together and they did this song for this girl and stuff. And there's all these beautiful things that we're starting to do.
Beautiful stuff. And I will say, as a Stanford grad to my Berkeley grad, that the Stanford band mashup is fantastic. It's worth finding our webpage and going down to that Hope and Grace section. But more relevant, Angela, to your question is that we've all been getting these questions for months, 6 months. And so pretty early on, we turned those questions into a blog, into a newsletter, which then is now on our blog. But I would say a better resource is that at our website, which is villagedoctor.com, there's an FAQ page that's searchable. And there are now about 100 different questions on that page. They're pretty good. I'm a little biased, but they're pretty good. And we try to keep them up to date. And so it's a nice resource for people.
Yes, thank you for sharing.
It's been a labor-saving effort, because we get the same questions, not surprisingly. We can now copy paste or send our patients to our FAQ page.
Yeah.
And we also have a blog on COVID. So if you just Google Pandia Health COVID, but it's just one page, long running, and you can just search for whatever you want. And originally it was like the latest and greatest is on the bottom, but now I've tried to kind of sort it with like the beginning is background, and then there's like the latest and greatest on the bottom. So like when they had a doc in the box for nasal pharyngeal testing, which was a plexiglass thing that someone invented at Harvard and had open source, I was like, here's the code. Anybody who wants to make it, go make it. And then here's a website where you can donate masks. Here's a website where you can buy masks. Here's a mask design we like. And, when hydroxychloroquine was hot, it was there for a little bit.
Yeah.
Oh gosh, we've got a TikTok about
and now it's
one.
there, like, don't do it, and here's why. But a great opportunity, again, for some more collaboration. It sounds like there's real mutually beneficial information on both those sites.
Exactly. Cool. So I'm actually going to go. We do have a couple more questions. And also, by the way, hello, Evo. Just really quick shout out, like quick little break for the docs over here. Hi, Evo. Hello. Hi. We also got Joel over here asking some questions. I could actually maybe ask this question just for Joel. Oh, hey, Jackie. And then we can get the rest of the questions we've been asked. So Joel asks, what are the best tips to host the traditional family holiday gatherings, if not possible to be outdoors? And that's perfect. Everyone knows Q4 is starting tomorrow, and that just means Halloween, Thanksgiving, and then Christmas, or if you don't celebrate Christmas, okay too. Like the holidays are around the corner. So yeah, what's your
Joel switch out his pizza photo for a turkey photo, but excellent question. So who would like to take that? There are a lot of layers to this question.
Yes, I'm gonna popcorn to Sophia.
Well, I'm gonna tackle the adolescent holiday, which is Halloween, right? I think that Halloween could be a giant super spreader event. If you have kids from different families coming together, trick-or-treating, yelling, trick or treat, or eating the candy as they walk along the street with their friends, or just somebody coughs all over the candy and then you eat the candy. It's just like, so my husband came up with a brilliant synthesis of Halloween, which is, this is just a way to spread candy. Like, I buy some candy and then I distribute it to the whole, neighborhood. And then my kid brings back the same amount of candy-ish. So, and ironically, interesting enough, some kids like a specific candy. So just go buy your kid a bag of whatever candy it is they like. And if they like a mix, then get the mix. But I would say it to me seems like a very high risk ordeal to have going door to door, or even if you leave it outside and they help themselves, it's just the touching and then the going around. Though I do, love the costumes. You are welcome to have a Zoom party. You're welcome to have little family, sub-clusters if everybody's been, quarantined and nobody's gone anywhere or touched anything. But mixing 5 different families or even more than 2 or 3 families to me is a scary thing. And going door to door, I would say no. Maybe we have a Halloween parade and you can parade and people can clap and like you as you go by or something, but not going around in groups, not touching everybody and back and forth.
Or they could all do the Michael Jackson Thriller online,
Do the dance. I'm all about dance, incorporating exercise.
Yeah.
So maybe that tip for Joel is to inspire the family to dance. But outside and spread out. But I see that if it's not possible. So one of the challenges as we roll into Q4 is that it's going to get colder. Like, we're blessed out here where it's relatively warm, but nothing compared to tropical Australia. But the reason for the question of outdoors is that, again, this virus is spread principally the way other viruses are spread, which is through droplets, through coughing and sneezing. And so the importance, again, of being mindful of that. So coughing and sneezing into your elbow, wearing a mask, washing your hands, but being outside, again, where there's ventilation, being distant, and not spending too much time together. Those are sort of the big things that you can manage to limit risk. Now, most of those are going to be difficult in a traditional indoor family Thanksgiving. So you can still be a little bit careful. You can be careful about not sharing utensils. You can sit people further apart than you might otherwise. But I think that the biggest thing, I don't hear this talked about too much, is this notion of a quarantine bubble. So if this is immediate family, you could pinky swear with your family members to be extra good for the 2 weeks in front of Thanksgiving. And to pick the extreme, if you were super good, as opposed to a super spreader, if you were super good, sheltered in place, got food via Instacart, and just didn't leave the house for 2 weeks, which is difficult. But at the end of those 2 weeks, anyone else who's done that, you can mix. The likelihood of you having coronavirus is vanishingly small. So if you can do it, that's the best solution. If you can do it mostly, then again, being careful around ventilation, distance, and some common sense precautions. And then the challenge, we talked earlier about risk and having everybody's interpretation of risk or their ability to tolerate risk can be difficult. So one of the challenges with family is that not everybody is necessarily on the same page. And so if you have those in-laws that, and we won't get into politics, but like to wear red and don't believe that this is really a thing, and are out and about mixing it up, like they want to go trick-or-treating and then come over for Thanksgiving, there's a place where I think you have to say, you know, next year will be different. But to keep your gatherings with like-minded people who take this relatively seriously to keep everybody safe. And that's extra important when families are gathered where they're at-risk people, like people who are older, who have other chronic medical problems. You just want to be extra careful with them. You know, we've gotten through 6 months. We need to get through 6 more months probably, but we can do this.
Yes.
It's important.
Yeah, we've canceled Thanksgiving in our family. My parents are on the 75 and plus age, and my brother has he has 3 children under the age of 6, and they're in daycare and they're in school, right. And his wife's a physician, so they're just like, and usually, whenever we meet with that family, we end up with a cold every single time. And so COVID is now, part of the mix, and it would be horrible to take down grandma and grandpa just because they wanted to see the grandkids. And so I strongly suggest you guys, everybody, look at the risks. And if you can truly quarantine for 2 weeks, you probably could go ahead and do it. I'm all about food. And so even if you can't be together, if you are nearby in the same city or whatever, if you cook it and it's something hot, so not salad, but like turkey or pie or something, if you heat it up enough degrees, then or microwave it, you should be able to kill any virus. And there actually, to my knowledge, has not been virus passed by eating on a surface or anything like that. So if grandma has a special casserole or mom makes a really good, I love her turkey noodle soup for the day after, then, you could go to mom's and she could leave it outside and you could pick it up and then you could get on Zoom and eat it together for fun. And then just, know that there are so many cool group games out there that you can play. Full disclosure, husband works at Apple, but there's a new Apple multiplayer game called Butter Royale, highly addictive, and you can all play together. But there's also Drawfully, where you can all do, it's kind of like drawing together, and there's card games and mahjong and bridge and poker. All that can be done as a family and bet on as a family too.
Ooh, get the casserole.
Yes.
Oh gosh, I'm so hungry right now. That makes
I know, it's not fair.
It's dinner time.
Next year, I want an invitation to your Thanksgiving. At least for leftovers, maybe.
Yes, the turkey noodles. Delicious.
So I have a question. So this is from Leanna Jack. So to Dr. Yen and Dr. Weiss, what do you think about the long haulers who have been experiencing symptoms for months on end? Do you think these people will recover, or is there a chance that they will be considered permanently damaged or disabled?
Okay, so I think this question is a perfect opportunity to remind everybody, including those who may think that this is overplayed, that COVID's really not that big a deal, that the mortality rate's 0.5% or some small percentage. So like the vast majority of people are going to live. Why are we making this a big deal? And I will note that how big an intervention to make, from a political and economic perspective, is a really challenging. It's easy to look back and go, ooh, we were too aggressive. I think you would always want to say we were too aggressive, and rather that we were not aggressive enough in defense of our public health people. But the point that I wanted to make is that whereas the mortality rate does seem to be low, and certainly for kids under 5 and probably for everybody under 50, but this morbidity rate, this notion that you get sick and you don't get better, I think needs to get people's attention. So there's a pretty sizable percentage of people who are quote unquote long haulers. Again, we don't know enough. I can't really tell you what the percentages are, but enough people are not better 2, 3, 4 months later that for me, that really, catches my attention. Like, we all appreciate our quality of life. We like to eat and smell food. We like to be able to run up and down the street and go trick-or-treating. The things that we like to do can be severely impacted if your lungs and your heart are not working the way that they used to. So it is a real deal. It does seem that people get better, and we hope that people get completely better, but it can take months and months. And we just don't know, for some of these folks who have lingering symptoms, if they'll ever get completely better.
Yeah. Well, that's not great news.
No, it goes back to it's a common.
Don't get it. Don't catch it.
Oh, yes. And do take it seriously. That is like, it confirms, that even though it's long, I think in the beginning, I've noticed, especially in my age group, people were very like, and then they, for the first couple months, and then later people started being less and less, careful about things because, and I understand it's been a long time, but we have to stay strong. We have to remind ourselves why we do this. It almost goes back to when you mentioned, both of you guys are mentioning quarantining before seeing your parents, or like being very careful. It's like being honest with yourself and making sure that it's not just for yourself, it's for the people that you care about, the people that you love, and getting them, infected or stuff like that. So.
And to come back to it, don't forget to take care of yourself. So we've touched on this a little bit, and there's a fair bit written about it, but self-care is key. And there are lots of things, there are ways to actually almost turn this to your advantage. So many of us now get to work from home. Maybe we spend more time Zooming friends that we haven't talked to in a long time. You can bake in your exercise routine. You can start to practice that musical instrument. You can eat better. You can meditate. Just don't take your personal health for granted. It needs some care and feeding too.
Yeah, and that actually is a perfect segue into our next question, which is, do both of you have any lifestyle tips for those who have gained weight during COVID-19? How can I keep myself healthy? And and also if you both can extend it to mentally healthy as well, because that is something you touched upon. So physically healthy and mentally healthy. How do I do that?
I'll start with the physical because I did do my master's in public health on obesity. And I'm also at the Stanford Pediatric Obesity Clinic, where we take care of adolescents and kids that are 99th percentile and above and who may want bariatric surgery. So I absolutely understand the COVID-19 pounds can happen from sometimes you take self-care. I like to say food is not love, time and money is love. And so don't reward yourself or others with food, but reward it with spending quality time with your young person, or reward them with money that they can use for music or sports or something physically active, rather than our family is doing ice cream and, boba and, cakes and all sorts of comforty food, but it shouldn't be comfort. That food is something to sustain us. Food is something we enjoy, and there are no bad foods, but also all things in moderation. So the tip I have, what's called the S diet, and it's not a diet. When I talk about diet, it's what do you eat every day? It's not something you do, you lose weight, and then you come off of. This is what you do now and for the rest of your life. And so diet just means what you eat. So the S diet is no seconds or sweets except for Saturday, Sunday, and special occasions. And then I modified it to single serving. So if you're going to a birthday party and you want cake and ice cream, you can have half a portion of cake, half a portion of ice cream, but not cake and ice cream. And just because it's Saturday and Sunday, you don't go all day crazy. You just get one single serving. Right. So that's a quick intervention. The more scientific one is the new plate model. Every meal you eat, you want to envision on a plate, and half of it is fruits and vegetables, a quarter of it minimum protein, a quarter of it maximum carbohydrate. And that is the radical part. Because I think if any of us get this quote, picnic plate or whatever, usually rice and then some meat on top and maybe some veggies, right? Mm-hmm. But your protein is equal to your carbs. So if you're only eating an egg, then you only get a little bit of rice, you know. And for carbohydrates, just to clarify, for those who don't know, you know, in general, rice, bread, tortilla, pasta, that. So you can't have tortilla and rice. It's tortilla or rice, or you have the two and you have smaller portions. And then if you can't eat fruits and vegetables for half, you leave half the plate empty, is another way to go there. And then
what about exercise?
Yeah.
So for weight loss, it's 95% what you eat and 5% exercise. In my 15 plus years at Stanford, I've never had a patient lose it on exercise except for 2 boys, 13-year-old boys who found a sport. And so if you're doing 3 hours Monday through Friday of soccer and 5 on the weekend, I will give it to you. If you're doing 3 hours a day cardio and 5 on the weekend, I will give it to you. But outside of that, you have to look at what you're eating. But exercise is great for maintaining weight loss. Exercise is great for decreasing stress because the cortisol will add on to the weight gain. But it is 95% what you eat. And then the simple 3-point healthy living contract that we make with young people, because how often do you have a 13-year-old sign a contract? Never. And so we want to make it measurable and something that they can commit to. We don't want to set them up for failure. So number 1, liquid calories. So as I mentioned before, pearl tea is going to be the downfall of all Asians, and Jamba Juice and Frappuccinos, those are all liquid calories. Anything you drink should have no calories. And I'm a believer in risk reduction rather than risk elimination. So diet soda is fine with me. Diet tea, diet anything, because we're just trying to cut calories. But also, if normally you drink 1 soda a day, if you drink half normal soda, half water, half soda, half diet, I'm okay with that, because at least you're now at half then instead of the full. So then the second one is TV screen time. We have what we call the god of pediatric obesity. I like to just call everybody who's amazing a god. And so Dr. Tom Robinson did research showing that in 3rd and 5th graders, if you turn off the TV after 2 hours, kids lose weight. No other intervention, no diet, no exercise, no nothing. Just turn off the screen after 2 hours. So certainly with COVID and school, we don't count school screen time. But fun time beyond 2 hours, and kids will do 3 p.m. until 10 p.m. So that's 7 hours that they could do. And they do. The average American does, I believe, 5 hours of TV every day. But 2 is the recommended. So no more than 2 if you can. Slowly get there. And if you do more than 2, then I say you have to bounce on a ball or run or jump during that time, which will decrease the amount of time that you actually do it. And then the third one is exercise. So you want to get 30 minutes of moderate exercise a day. But again, it's 95% of those dietary interventions and 5% exercise in my experience.
Yeah. And I totally echo that. So just in a clarifying question, does this count as TV?
Yes, any form of media. So definitely young, and they've actually seen a gender difference, that young women used to be on the phone a lot more and the dudes would be on video games, but now everybody's equalized everywhere. Any screen and any just sitting around. TV is particularly bad because they'll throw in food advertisements, and the food advertisements have become smarter over time. If you simply say the word Burger King, it will trigger a Pavlovian reaction in me where I just start drooling. Or if you invoke pizza, even though I've eaten an entire meal, but you show it to me, I'd be like, yes.
Yes. And actually, I kind of want to segue into like more of the mental health part of it. I've noticed also that a lot of people have been talking about, being more isolated. You guys even mentioned about how there are times where you're isolated from your family when you're quarantining, or also even just 2020 with a lot of unfortunate things happening. Everyone is just mentally bogged down, right? And
well, you've got partners on the other side of the world as well. You've got family members. Like,
you're single.
Or you're single and like don't need
how are you gonna date like during
that's a whole other thing, isn't it?
That's probably another like live video is like how to date properly during
that there's lots of things with that. So one thing I just want to echo what Dr. Yen said about food and exercise and weight, because we do have this many of my patients have this notion like, oh, I'm okay, it's time. I'm up to COVID-15 and I want to stop. And their intervention is around exercise because it's something objective and easy to and it's just not going to move the needle, literally. And so it's this relation, it's food, it's what you eat. It's, again, portions. I wrote down, I love the S diet. Serving, I wrote down it should be sensible portions, right? It's like, don't eat too much. Yeah, you can use that.
Yes.
As much as you think it's hard to be on this thing for 2 hours, it's kind of equal. It takes equal attention to be portion controlled, both in terms of amount as well as components, just as Dr. Yen.
Especially if you have the time to be a master chef right now in your home.
Well, so that's a good segue to the other challenge to sort of bridge to emotional health is that many people use food for comfort or as a reward or have a relationship with food that goes way beyond a healthy diet. And in these days, when we're all sitting around looking at a screen more than we should, we get bored and we nibble. So one of the other things that I would say don't do is don't eat. If you're going to watch TV for 2 hours, don't eat in front of the television. Like food should be intentional, delicious, enjoyed, ideally social. It should not be something that you have this bottomless bowl of something that while you're watching, Mad Men or whatever your favorite TV show is. There was a great, back to memes, there was a great photo I saw quite some time ago where, somebody goes to the refrigerator, you open the refrigerator, there's a big sign that says bored, ? Turn around, something like that. We tend to eat for all the wrong reasons. So
I guess with this one, in regards to mental health, I was thinking before when Dr. Yen was talking about exercise that you do get endorphins from exercise.
Totally.
So that's probably, and I know, for example, you, Dr. Weiss, you've been doing a particular type of exercise during quarantine.
Oh, what is it?
There's a plug. Undisputed boxing, my friends. So Danny introduced me to kickboxing a few months ago when we had the pleasure of being together as opposed to 7,000 miles apart. But it's really, again, I try to do that as a routine. I think I would come back to one of the pieces around mental health is take care of yourself and literally schedule if you need to, but at least have a day where there's things that you do for you on a regular basis. So if you're going to be working behind the computer, then every day at 10 or 11, I'm going to go get my exercise. And I'm not going to eat until 12. And I'm going to be mindful about, follow the S diet. And I'm not going to do that in front of a screen. And then maybe in the afternoon, I've scheduled some time to Zoom friends that I haven't talked to in a while or to talk to my family. So I think intentionally creating kind of a schedule and a routine for yourself and then following it. It's really easy to drift into this sort of depressive time of loneliness. And it's relatively harder to do that if you've built some of this scaffolding in.
I think a part of that too, if I could interject, is mindfulness, being able to read or meditate or go for a walk in the park, being out in nature, because we're so on our screens all the time that we forget that because we're not with friends and we're not meeting friends at the park or whatever, there's still this yearning for us as humans to be connected with nature. And so it's really important that we go out and we get our vitamin D refill, and we're able to look at the grass growing or the ants, just like you would when you're a child. Like you see a child playing and pulling the grass out and looking at the world. That's amazing. You now have this opportunity to see the world in that way again, and that I think that brings so much light into people's lives when it's all about screens right now.
I totally agree with that. It's like now, now that you're working from home, everything is from home, you don't have time really for yourself. And I think there's also been studies that have shown that now that you work from home, you get up and you take one step and you're working, and you have time to, enjoy the world around you. You're not driving, you're not meeting people at a coffee shop, or you're not having these interactions that you typically do. And I believe you guys have mentioned before that that COVID-19 or like everything that's going on since COVID-19 started, like has changed the environment in which we are in, how we interact with each other, how we live our daily lives. And mentally, it just, how can you mentally stay strong, or mentally find a way to not stare at the screen, not work so much, and then overwhelm yourself and then get burnt out, or feel sad. And I'm sure that there's studies that have shown some type of correlation between being stressed, being sad, being like all of these negative emotions that you build up, and how you live your life, right? Or how it might even affect you if you have COVID-19, or even just, with cancer patient people. I know when my mother had cancer and she was like, we always try to make her happy, and try to make sure that they're mentally strong and like there so that they can get through, any type of illness better. You know what I mean?
Yeah. So laughter is a great medicine, right? Love is a great medicine.
Songs, music.
You can play games, you can watch, comedy on a couple of different screens. The technology allows for a lot of that, but you have to kind of seek it out. It's so good for you though.
Can I ask another question? I'm hoping to understand, what is the SARS, how is this SARS different from other SARS that we see on the Clorox bottle?
Yeah. Yes. Yeah. I maybe let me add like a little bit to that, because that was a personal question I've just been seeing. I'm not sure if any of the people following us now have seen those memes where they're like, SARS has been around forever. Like, this SARS is not new. Or, there's a lot of people just saying this, whatever SARS and COVID is now is, how is that different from the SARS labeled on the Clorox bottle that says will kill anything, including SARS? Yeah, what's going on with that?
Well, part of it might be Clorox is on their game. They've had some unanticipated marketing. So do not drink or inhale your Clorox. Let's start with that. The other is that SARS is just a description, right? So I might get it wrong, but it's subacute respiratory syndrome, something like that. It's a descriptive term around symptoms. And so there have been SARS before. It's not the same virus as the current coronavirus that's causing SARS. SARS is a description. You could say it's like cough. So cough has been around a long time. This new cough isn't a new cough. It's all a hoax. It's like, no, the virus that's causing the cough, the current cough, is new. Hence, COVID-19, it's a novel virus that was discovered in 2019. So SARS goes back. I think there are hundreds of kinds of coronaviruses out there, and they vary in their severity and their novelty. So this one is new and relatively bad. And that's a dangerous combination, because it makes people sick and no one's seen it before, so there's no immunity to it.
So just to be clear and to reiterate, do not drink Clorox.
To be clear and to reiterate, do not drink or inhale any disinfectants like Clorox. Do not put any, just that. I could get started on that.
Do not inject it in your blood. Do not put it up your rectum.
Right. Nor any like mosquito zapper blue lights, nothing that you should push into your body. No. Here it says, listen to the expert doctors.
Okay. So I do have, the next question is, what are the updates with vaccines? Is there a progress of it? What's going on there? And how do we know when one will be available?
I've been following the UCSF. They have, if you follow Dr. Bob Wachter on Twitter, he is, I believe, the head of medicine at UCSF, and we're both UCSF alumni, so we love UCSF.
Yes.
And
we love Dr. Wachter. So
yes, and so whatever he's tweeting, go with that. Whatever Fauci's tweeting, go with that. But there are definitely vaccines on the horizon. They've, put it together, but definitely not going to happen before November voting,
No.
and definitely not going to roll out, to everyone immediately. And that is a question that's come up, is if we gave it to the most indigent countries, that would have the greatest impact. But it's the rich countries that can afford it. So will the rich countries do the right thing and allow those that would most benefit from it? Or are we going to suck it up because we made it and we have the money, so we're going to eat it, and use it? But also know that we're going to give it to the most high risk people first. So probably, healthcare workers and older people, and then everyone else. So it's not going to happen, I feel, complete rollout for at least a year and a half,
Mm-hmm. So unfortunately, I agree. So there's the good news, bad news. The good news is that this global pandemic has seen incredible global cooperation amongst scientists. The science here is incredible. We are developing a vaccine to an unknown pathogen in 12 months. Like, that's never, ever happened. There's some big challenges with that. There's some big political challenges with it. So once it becomes available, who gets it? There are some infrastructure challenges. So there are two particular vaccine candidates right now. One of them needs to be stored at a very, very low temperature. So there's a whole kind of cold chain problem, which makes getting vaccine out into rural or more developing countries more challenging. But I think that the good is there's been this amazing collaboration. There's been amazing science across institutions and across countries. This vaccine is already in phase 3 trials in this country. It's already being used in other countries. And we could get into some really interesting geopolitical strategy around balancing who gets the vaccine first and what you can do with that as a country if you have it. But as Dr. Yen says, it's going to be rolled out to those who need it most. And I hope that we can all commit to taking the high road, and that as a country, we're not likely to be fully immunized really until the end of next year or after that. Mm-hmm. Really, I want to go back to, it really goes to, again, education and listening to science. This country faces a huge challenge that perhaps as much as 50% of people in the United States of America are worried about even taking a vaccine because there's so much misinformation out there. And if half the country doesn't take it, the other half is very much at risk, because you need to build this group or herd immunity across the country. So this sort of thing, getting the word out, educating people is so, so important.
Thank you. And really,
yeah, it certainly is, yeah.
Before Danny asks our last question, because we are trying to, wrap it up at 6, but don't worry if you all enjoyed, by the way, are all enjoying this broadcast, make sure to, like everything, comment, share this with your friends, share this information with all your family, and also just comment, and then we might be able to do this again. But really quickly, before our last question, I want to give a shout out to Jane. Hello, Jane.
Yeah, hi, Jane.
Hello. Yes. Valeria, amazing live stream. Thank you all for keeping us updated, COVID-wise. Much love. Love you too.
Nice emojis.
Yes. Emojis. Love them. And then we have some shout outs to Village Docs from Rhea.
Lovely.
Yes.
Thank you,
and yeah, thank you.
Shout out
and
then, to help. It's all good.
Yes. And then we also got some hellos from Carla and Viku. So thank you all for joining in. And let's get started. Danny, you want to introduce the last question that we have for today?
Sure. So we've kind of touched on this, but I think it's a really good one to end this discussion, which is, once again, how often should one be getting tested?
Good question. Dr. Yen, public health god, do you want to?
I'm not a god of public health, but I do have an MPH, as does Angela. But I definitely, it came up today on Stanford's Grand Rounds. It's really interesting, just so you all know, that they found a correlation between elevated heart rate and illness in general, and it may be a proxy for temperature because they didn't have a thermometer, but they had the heart rate thing, and it may be a proxy for decreased oxygenation, which may be, you know, a harbinger of COVID too. But the point of that is trying to test people, as you said, they're sometimes infectious a day before their symptoms show up. And so if you have symptoms, definitely get tested. The question is, if you don't have symptoms, how often should you be getting tested? And I've seen a lot of 20-somethings trying to be responsible. They go out and party and then they get tested, you know, and then they go party and they get tested. But what if they're in that window? What if the test has a false negative? What if it was a poor sample? Then you just shouldn't be doing behaviors that are causing you to get tested. It's kind of, to me, similar like HIV testing. It doesn't happen that often, and we've scared the crap out of you. And when you test negative, you're like, it's nothing. They just lied to me. It's not as bad as it is, or as prevalent as it is, or as easy to catch. But the reality is, if you catch it, it's not good. So don't do stuff that would put you at risk of it. So I think I'm not quite answering your question, but definitely if you're symptomatic, and don't just use it as a badge to go do crazy stuff.
Right. Yeah. So I totally agree with that. It is interesting. There's really interesting work on wearables. So this notion, and there's work at both UCSF and Stanford looking at how to try to predict illness or even contagion, but mostly in frontline workers. So that's actually really fascinating. You know, my political soapbox would be that we don't have enough testing in this country. So if testing were really readily available and inexpensive or free, you could make an argument, and maybe I'll get to that in a little bit, about how often to test as a screening tool. But a test is not to be used to change behavior, just to Dr. Yen's point, is that we know that perhaps as many as 50% of people who get COVID never have symptoms. So this sort of having symptoms thing is not helpful. We also know that it takes quite a while to develop symptoms after you've been exposed, and it takes quite a while to get rid of virus as you start to get better. So there are these big windows where you could test negative and then start to shed virus tomorrow and shed virus for a week. So this idea, this young, like, let's get tested and go to Vegas, really bad idea.
That is
right. If you're talking about school or your medical office or home, maybe where there's people at risk, and you could start to talk about the value of testing maybe every 2 weeks. But that kind of testing is not a hall pass to go party.
Yes. Yeah, I want to echo that because being in this age range, and I am very, active on social media. I even have a couple of friends who have talked about that, how they're like, okay, let's all get together and don't worry, got tested 4 times. And, I've seen it on YouTubers with millions. I've 9 million followers. I've seen some YouTubers, not going to call out any names, but they say, got tested 4 times, guys. So don't come for me if I'm posting them with my friends because I got tested. And so I think it just is, like you all said, it's not an excuse to go out and do behaviors.
But I guess with that, Angela, you've also got to think about those folks. They're with other people and they don't know where those other people have been. And so you could get tested 1,000 times, but that's for your benefit. And if those folks that you've been hanging around with haven't been tested and just all of a sudden you get COVID, your test isn't an immunity to it.
That's a good point.
Right.
Yeah.
Exactly right.
Yeah. And so I think it's really good to just go back to, taking care of yourself, being responsible and accountable for yourself and for the others around you, because
for your community, right? Be a good human.
Yeah. Wear your mask, wash your hands.
Yeah.
Be a good human.
I mean, it's just, again, the tragedy of how things have become politicized, right? So we talk about, props to Stanford and UCSF and many other medical institutions. The science is rocking in this country. But the politics, the fact that wearing a mask, which we know makes a difference, has become this political statement is just absurd. So be a good human, wash your hands, wear a mask, be respectful, keep your space.
The virus doesn't distinguish between political parties,
Correct.
and public health should not be political.
I like those quotes. So, I love, yes, let's end it with a clap. I think those are
There it is.
You know, and so with that being said, we got a couple more claps. Thank you, Joel, for clapping. We got Vicky.
Yeah, Joel, thanks.
Yes, thank you, Joel. Thank you, Vicky. She said she loved this expert doctors discussion, smiley face. Hopefully we can like talk more about it. I don't know if you will all be interested. We could talk more, but we were mentioning dating and COVID-19.
Oh yeah, I think that's a good one.
That's next time. That'll get people's attention, right?
Yes. We'll get all the singles.
Time of COVID.
Yeah, that could be the next way that we go is our next thing. But with that being said, I want to thank everyone for joining the call. Thank you, Dr. Weiss. Thank you, Danny, for coming in from the Village Doctor. I want to again give you a shout out and make sure everyone that's following, please check out their website, villagedoctor.com. They have FAQs. They got a newsletter going on, so please subscribe to them to keep updated. Also on their social media. And then also thank you, Dr. Yen, for joining us again today. And
a huge thanks to you guys.
Thank you, Angela.
Shout out from us to you.
Just like we should do, like everyone do like a what I don't know, maybe.
Yeah.
Oh gosh, that's so cheesy.
Everyone should all do like let's all do like one.
Yes. It's getting it the right direction, right?
Yes. I love this. So this will be repurposed all over the place.
Yeah, no doubt.
Okay. Well, thank you all for joining. Make sure if you do sign up for our services, use referral code, Village Doctor, so we can see how many of you guys actually saw this and want to use these services.
Yeah. And that's a shout out to what you guys are doing. So if you have any questions about sexual health and birth control, get on to Pandia Health, and you guys are doing amazing work. So keep it up. Even more important, man, that's a whole other topic about what the future of this country looks like. Keep doing what you're doing.
Yes, thank you. Okay, well, with that being said, thanks everyone, and we look forward to seeing you all on our next one.
Sounds
Thank
good.
you so much. Bye.
Bye.